and I'm happy to be here today to share a few thoughts and a few perspectives on various issues, especially on flood and disaster, or the preparedness of our nation to tackle calamities, to preparedness of our nation to tackle calamities and things like that. I think it is also sequential and evidence of the general state of our nation and the things that we're doing there. We have a very special guest today, but before he comes on, we're going to first of all have conversations around the topic of disaster management in Nigeria, especially, in the face of the last flood, which is still not totally and completely dealt with, that rendered many, many people homeless, rendered homes inhabitable, rendered people unable to access farmlands, and all manners of things that happened in that particular situation, and made life really complicated for a lot of us. And all sorts of things that we heard from government, and we heard from people in government, and the response of government to that particular incident. Please note that this is not the first time this has happened in Nigeria. We've had issues of flooding in the past. We've had oil spills, disaster oil spills, especially in the Niger Delta, that were not properly or efficiently handled. We've had fires, and then especially in the cities, we've had a lot of building collapses, and all manners of disaster like that, which has affected many, many lives. And then also there's the issue of banditry, Fulani herdsmen, which almost have become a disaster proportion, and raids on communities. Communities have been raided by other people, other citizens of Nigeria, ransacked and ravaged and damaged homesteads, and so on and so forth. So we'll be looking at some of these issues, the preparedness of Nigeria and the Nigerian government to cope with this sort of disasters. Please mind you that there are disasters and hurricanes all over the world. In America, there are many, many disasters on an annual basis. And in Europe, there are many disasters here and there, flooding, even in India, in China, and parts of the world like that. Maybe guests can also help us to do comparisons of how these things are handled and tackled in these countries as against how we handle and tackle them in Nigeria and also in Africa. Our guest is the representative of UNICEF in Nigeria. He is Chief of Health, HIV and AIDS. He's also has on the platform a few of his colleagues who will be speaking on the issue from the UNICEF Nigeria office. And we're looking at specifically what they have done in response to flood and disaster in Nigeria, and what kind of support system we should be looking at. And maybe they can help us to provide and granulate a vision and a direction for the incoming government in 2023. What are the key things and the key issues that they should deal with in terms of ensuring that we have a stable situation in Nigeria? We're expecting that they'll provide a situational overview of the past flood situation, also share current and unmet needs, and offer recommendations to support ongoing efforts in these critical areas. And then I'm sure some of us who were not able to be there must be experiences with flood victims. How have they coped and how have they survived? Please welcome with me Dr. Eduardo Celades Blanco. Dr. Eduardo Celades Blanco, Chief of Health, UNICEF Nigeria. Dr. Blanco, you are most welcome. Thank you for agreeing to be on the African Leadership Group, the Nigerian Leadership Series platform. It's a group that we have regularly every Thursday at 5 p.m. to look at issues of management, leadership, a little bit of politics now and again, but most importantly, good governance in Nigeria. We're very, very particular about that. And also across Africa, using Nigeria as a milestone. Dr. Blanco, welcome, and you have the floor. If I've not introduced you properly, please feel free to tell everyone what a great man you are.
You did. Thank you very much, Itwa. I hope you can hear me. Yes, excellent.
I can hear you.
So first of all, thank you very much for inviting me today to be here with you. It's an honor to be here. As well, some of my colleagues from UNICEF Nigeria have joined the call. We have Dr. Ege, that he's based in Port Harcourt, and he has very recently came from Bayelsa. As well, we have Dr. Ifejingwa, that she has been in Anambra, one of the key affected states. But first of all, before going there, let me just thank you again for inviting me today here. I have been now 1 year in Nigeria. So actually, literally, I arrived here 1 year and 1 week ago. For a doctor as me, as a manager, as a public health specialist, I have to say this is one of the most fascinating countries at this moment in the world. People say that if you can fix Nigeria, you can fix Africa, and if you do Africa, you fix the world. And this is very true in some of the challenges that we are facing, like COVID-19, for example, has been something that we have been working a lot. Because if you remember 1 year ago, Nigeria was even destroying COVID-19 vaccines, for example. But the same happened with measles. Nigeria was facing earlier this year the biggest measles outbreak in the world. As well with cholera, we'll be seeing some of that. And now with the floods. So, of course, this is, as you know better than me, an extremely complex country, but fascinating country, and that has the capacity to really respond to the many challenges that it's facing. I have prepared like a 5 slides presentation, so maybe I can project that if I am allowed. Thank you. So let me. Okay, so let me let's see if I project the screen. And now let me see if I can see this. Are you seeing the full presentation?
Yeah, we can see a map of Nigeria in blue, light blue, and dark blue. Yeah.
Excellent. So just as an intro, right? This is so what we are seeing with the floods and in general with climate change, and it's very relevant that we have this call today because, as you know, the COP is ongoing in Egypt, discussing like climate change and global war and like the rise of temperatures. So what we are seeing is like we have extreme climate events more often, more frequent, and more severe. And Nigeria is not an exception. And this is what we are seeing this year, right? As you were saying in the intro, it's not first time that Nigeria is facing floods or even droughts in the north. But what we are seeing is the severity of that, it's going up. In the ones that we faced in October earlier this year, like 5 weeks ago, more than 3 million people have been affected by the floods. More than 1.4 million people have been displaced. So basically they lost their homes, at least temporarily. 34 of the 36 states of the Federation have been impacted, and more than 600 people lost their lives in what the flood is. But remember that from a public health perspective, floods are not an immediate killer. Like in an earthquake, for example, I mean, I don't know how many of you are medical doctors, but in an earthquake, for example, you will have a lot of trauma, a lot of injuries in the earthquake, a lot of deaths. With floods, it's different. Few people die with the floods, but they will die in the upcoming months because of the communicable diseases like cholera or malaria. They're going to be the 2 main killers over the next few weeks and months. And if you see the map, I mean, you can see it very, very clearly, right? Like basically the most affected regions, it's around the confluence of both Benue River and Niger River. You can see Lokoja, Koji, that is there, right? How is the most affected? And then all the basin going downwards, ending in the delta, in the river's delta, and Bayelsa as the most affected places. So this is the overall picture from like this is updated like 1 week ago. If we move to the next slide, is like the situation overview. And because of my expertise and the section that I'm leading in UNICEF, I am focusing on health, but as well, there are other issues like nutrition and water and hygiene and sanitation that they are a priority. If we look to Vallelsa, more than 62 health facilities have been affected, 13 in Anambra, 92 in Koji, and more than 60 in Jigawa have been affected by the flood. That means that the water went in, and for example, drugs and equipment were damaged. As a very concrete example, almost 180 cold chain equipment, this is the freezers where we have the vaccines, are non-functional at this moment. It means that all the vaccines that we had, we cannot use them anymore, right? And as well, we cannot bring new vaccines because they are not there. As well, even this has affected the healthcare workers. For example, in Koji State, that they have lost their homes or the places where they live. One UNICEF staff in Vallelsa, our only staff that is there permanently, his own house was affected, for example. So really, this affects as well healthcare workers. As well as another side effect is like some displaced people are living in schools or in health facilities. And for example, in Niger, this is happening in 3 health facilities. As well, a very typical consequence of any floods is that you lose the access to the health facilities. Health facilities are damaged, health workers leave because they cannot be there. So basically, you lose the access to health services. This means no health access to a safe delivery, to an antenatal checkup, to a postnatal checkup of the baby, for treatment for malaria, for any pneumonia, etc. And our main concern as UNICEF and as a public health practitioner is the risk of communicable diseases and outbreaks. And the main 2 ones that we're going to be seeing over the next few weeks, it's cholera, and as well as an increase of malaria cases. And this morning I was with the malaria coordinator of the national program, and she was very concerned with the potential, with the increase of cases of malaria that we're going to see over the next few weeks. As UNICEF and the UN, what we have been doing. So normally in floods, we have 3 main priorities. The first one is to ensure the continuity of health services. As we saw before, when there are floods, so you lose access to that. So basically what we are trying to do is to ensure this continuity normally through mobile brigades or mobile clinics or outreach. They are different names, but basically it's going with nurses and doctors to the communities affected. This is the first thing that we normally do. The second one is to reestablish the facilities that they have been damaged. Normally they lost drugs, equipment. They are like as well, sometimes very often the roof or even the walls are destroyed. So just to do a small repairs on these facilities to provide the drugs again and to provide the equipment. So this is our second priority. And our third priority is to avoid the outbreaks of malaria and cholera, especially. And normally this means to distribute mosquito nets, cholera kits, and then ensure adequate water is coming to the facilities because, of course, it needs to be safe water. So this is our 3 priorities. In the north, that they were, especially we have been very active in Jigawa and in Niger State, and we have been doing some of the things that I have been highlighted. So in Niger, we have been doing the mobile health outreach, cholera prevention, a continuation of the primary healthcare services, medicines and supplies. In Jigawa as well, we have been giving cholera kits. This is kits that they have what you need to prevent cholera, right? Like, for example, chlorination tablets and others, and as well soap, etc. So this is quite important. And we already had, even before the floods, especially in Adamawa, this is the state more affected, we already have an ongoing cholera outbreak, especially in Maiduguri, in the 3 Bay states, in both Borno, Yobe, and Adamawa. We already had a cholera outbreak. So we have intensified our response, especially in Adamawa. In the south, our response is slightly different, but more or less is similar. So in Vallelsa is the place that it's more difficult because of the lack of access. Still, we have a lot of communities that we cannot really access. You can only go by boat. This is all the river island communities, etc. So in Vallelsa, we are doing the outreaches, but it's complicated and we still have gaps in our response. And the other place that we are responding at this moment is in Anambra, where as well we have included immunization because of the cold chain that was destroyed. So we are doing vaccination of children. In Koji, unfortunately, at this moment we couldn't support because we have limited resources. So we have been focusing more in Anambra and Bayelsa in the south until this moment. So what are the gaps? What we think still is needed? So in the north, we need the quickest way of supporting health facilities that they are destroyed is with essential kits. A health kit is a kit that is already prepared with a number of drugs and equipment, right? So it's much easier like to do, I'm going to buy amoxicillin today and tomorrow paracetamol. It's much easier to get the kits. So I think we in the north, we need the health kits and the cholera kits to be ready and to be deployed. We have a very extensive network of community mobilizers working at community level. So we are working already with them, but they need more support. As well, we have an issue with accessing safe drinking water. Cholera is a huge risk because there is already cholera ongoing there. Then we need to restore over the next few months, and this will take at least until March next year, to restore some primary healthcare centers. We need to do more mobile medical outreach teams. And as well, we're working very closely with the government structures, including the health commissioners, the SPHCDA, etc. In the south, the complexity added, especially in Bayelsa, is the transport to go to the communities that are more displaced. And as well, the population is very much scattered, so it's much difficult to reach to them. As well, we are planning to do some rehabilitation of damaged health facilities. And we believe we need to do more health promotion, right, to avoid this increase of malaria and cholera that we are expecting. Then how do we think that, I mean, it's first time that I am meeting this group, but let me see, the last slide. So, sorry, this is the last slide. Yeah, the last slide. So how this group, I understand that you guys, you are not based in Nigeria, so you live abroad. There are many ways, of course, that you can support. I'm sure that you have family, friends, communities, etc. Of course, from UNICEF, we are responding from the health needs, but as well, there are many others as well that they are responding. We have the Federation of the Red Cross. We are working with them in Bayelsa, for example, and they are doing a great job. And as well, there are other national NGOs like the Mon Club, the Hadegia Women Foundation, and others that they are as well helping. This morning, I was meeting Shell, for example, that they were telling me that they were doing a lot in Bayelsa. So we agreed to coordinate, and maybe if we are going together to the same places, so we can put efforts together. So I will stop here just to let you know that, I mean, as I said, floods is not, the mortality doesn't come during the floods, come after the floods. It's different to earthquakes, or is different to other public health emergencies. I have, maybe if the chair allows me, I have two colleagues that they just came back last week from Bayelsa and from Anambra. I would like to invite Dr. Ege, maybe from that just came back from Bayelsa, to give us, like, Ege, if you can, in a couple of minutes, a quick overview. And then maybe Fejingwa, that as well, she just came from Anambra. So if I am allowed to pass it to them, I would like them to explain, like, firsthand, they just came back from there. So to explain to us what they saw. So maybe Dr. Ege, over to you.
Dr. Ege? Maybe he's still in Bayelsa. Is he there?
Okay, if Ege is not here, maybe we have Ifejingwa.
Ege is there. Ege Abe.
Yeah, I'm here. Hello.
Ege, are you there from Bayelsa? Unmute yourself.
Ege, if we cannot get Ege, maybe colleagues from Enugu that just came back from Anambra, are you there? Dr. Ifejingwa?
Would that be
Okay,
Enugu Health?
yeah.
Okay.
Yeah. Good evening, colleagues. Thank you, Eduardo. Yeah, like Eduardo noted, we just came back from a mission in Anambra. I went with the Chief of Field Office. We had a meeting with the Deputy Governor of Anambra State, and we also met with other UN agencies that were already also, they came into town. That's IOM, UNFPA, and Delta Res, one of the international NGOs. And the meeting was basically to map where partners were going to support and what our areas of purview would be in terms of the response. Like Eduardo mentioned, the flood situation in Anambra is such that we've never seen. It's affected 1/3 of the state. Already the state is ravaged. The state has already lost a lot of the landmass to erosion. And while they were still battling with that, they were faced with a flood challenge that affected about 1/3 of the state, about 33% of the state. In some local governments, some were worse hit than others, like Anambra East, Anambra West, Obaru local governments, Oka North. Those were the worst hit. And then we had other local governments like Ekusigo, Ihiala. A lot of holding centers were set up with SEMA. IOM is a coordinating body, working closely with the state partner, which is SEMA. And then all the other partners were also, contributing to the response. For us as UNICEF, like Eduardo has mentioned, particularly for health, our response as a field office cuts across the water and sanitation sector, the child protection sector, and then the health bit. One of the things we've done one of the areas of priority for us is the restoration of basic health services, because a lot of the health centers were flooded. There was interruption of provision of primary healthcare services. Children could not be immunized. Our cold chain equipments were damaged, and those that waited till the last minute were caught up with the flood. And even during the rescue mission, there were cases of loss of lives, because of how torrential the flood was. And so our efforts have been to ensure the continuity of health services through medical outreaches to the holding centers. And then looking at provision of an integrated package of services, like a basket of services that will cut across the health needs. And of course, not leaving out immunization program. Beyond the medical outreaches, we've also started taking stock of the facilities that are damaged and taking stock of the equipment that are damaged. That will better provide us with the relevant information to provide support in that area. We're also looking at avoiding the potential cholera outbreaks. And so we've made the request to the country office, and we're expecting cholera kits very soon in the state, which the state is already primed to receive and ensure that they are delivered to all the necessary areas. We're also looking at, the state just had the campaign for mosquito nets. So one of the things we're also going to do is to look at the needs assessment, areas that were not covered, and then to see how to close some of those gaps. So this is in a nutshell our focus for the next couple of weeks. Thank you. Unless there are other questions. Thank you. Over.
Thank you very much. I don't know if the other gentleman is available now.
Yes. I'm around now. I'm unmuted now. Good evening, colleagues. Are you hearing me?
We can hear you. Go ahead.
Okay. Yeah. For us in Bayelsa, the first major challenge was even accessing Bayelsa. It was only this last week that we were able to get into Bayelsa. I'm actually still in Bayelsa now. We got in on Sunday, and what we saw from the road till we got into the town itself, it was really devastating. And we were able to visit some IDP camps, though many of them are now being closed. A lot of them and a lot of the IDP recipients are now going back into their various homes. But some houses are still flooded. You can see anxiety in the faces of the people. They go home, they try to clean up. The next day they still come, thinking whether the water would have really receded. The water is still where it is. Right now, the water is stagnant in many places. It's not moving any longer. And it affected the whole of the state. Even initially, when we thought that 2 of the LGAs, Bayelsa has 8 LGAs, that 2 of the LGAs were not really that much affected or impacted. Right now, what we are seeing is that as the water is moving back into the ocean, those 2 LGAs, Brass and Nembe, that were not initially impacted are now getting impacted. When we visited some of the IDP camps, what we saw, a lot of the children were still there. They did not know where to go to, and that one was really hard. We had some deliberations with the state emergency management agency, as well as the Ministry of Health. And what came across was, one, there was really not much good coordination between all the agencies, and which is what we think that UNICEF and other partners can join in. Then we have also started, even while we did not have access, UNICEF, what it did was to procure some medical items to support another consumables like palliatives, dignity pads, and mosquito nets and blankets for the people that are in the various IDP camps. These we have now distributed, and also we have commenced the medical outreaches, integrated outreaches, wherein medical drugs, anti-malarials, and also cholera kits are given to the various communities. We have started it, and we have so far done more than 8 communities, but there are still some gaps, a lot of gaps, because what we have cannot go around. We have seen that the communities impacted are more than 300, and right now we're only able to get up to about 100. So those are some of the things that we have done in Bayelsa, but the scale of devastation in Bayelsa is really, really much, and there will be a lot of need for support to Bayelsa. Thank you, and over.
Thank you very much. I don't know if Eduardo has anything to add to that before we start to ask a few questions.
No, I think we have as well our colleague. I can see Idris, our colleague from Niger. If I can pass it to him, maybe just to give the full overview, to have as well one state in the north to see the differences, and then over to the audience. Maybe Idris, if you can just in 1 minute, please, Idris, because so we can have a discussion.
Okay, Idris, the ball is in your
Thank you very much. Thank you very much, Eduardo. I was unmuted by the host, just barely got unmuted now. Thank you very much, the ALG leadership. I think I just want to add to the experience we had in Niger State. We visited Lavum local government, specifically Kacha area. Just like what Dr. Ege said, the agony and the story there is something that I think people need to really go and see. That was the first village that we saw all the schools and the health facilities converted to IDP camps. And that really created total lack of access for people to come and even have the basic care service that they require. The equipment and the drugs have been destroyed by the flood. Children cannot go to school. 16,071 children were line listed who were now out of school. 1,781 of them were women that were pregnant, out of which 5,000 or so were children under 5. So what Eduardo said in terms of what follows after this tragedy really matters in terms of malnutrition, in terms of malaria, in terms of cholera and other outbreaks that may claim the lives of these children. What they did, and surprisingly, is at the end of the day, the male blocked a section of the road with their motorcycles and cars to provide a sleeping space for themselves, because they had to vacate the schools and allow women to be sleeping under cover, while the men sleep on bare road, just using their cars to protect themselves from being crushed on the road. That was really a very gory sight that we noticed. And unfortunately, the kind of support that goes to these people was so minimal. And by the time we got there, actually, just like what Ege said, the minimal things we were able to provide was so small that we feel that we've not done much. And I think a lot more can be done. So probably we would have loved to share some of the pictures that we have from there. But I think maybe as we meet further, we should be able to provide more insight into what the situation look like in those particular areas. Thank you.
Thank you very, very much. And I must really, really commend UNICEF and the entire team for the great work that you are doing in Nigeria, and especially your response to this flood. Clearly, from what you have said, we are still not able to mitigate all the effects of the flood and all the challenges that are needed, and quite a bit of help is needed. But I just have a couple of questions, and then I'll throw the floor open to my co-presenters, Jumoke and Sonny, and then to the rest of the audience to ask a few questions. Is that one, could this flood have been prevented? Is there something that the Nigerian government or the Nigerian people could have done to prevent this flood? Perhaps even the first question is, what caused it? It was definitely not a downpour. It seems as though it was some water infiltration from the banks of the Niger or the Benue, I don't know. So could it have been prevented one way or the other, anticipated and prevented, and the effects mitigated? Okay. And although I probably have an answer to the question, but I don't know if you're able to comment, how disaster ready are we in Nigeria? And what has been the response of the Nigerian government or the Nigerian people, and what more can we do? And then, of course, how do we mitigate or prevent or anticipate this sort of thing in the future? I think those are the three areas that, as from me, I'd like you to please look at very quickly. Thank you.
Do you want us to respond to this question, or shall we get a few questions before?
Maybe you respond to this one.
Okay.
And then,
so that's a very, very good question. And let me just start by saying that the impact of any disaster, man-made disaster or natural disaster, it's always depending on two variables. One is the vulnerability and one is the risk, right? So we know that because of the season, because of what's happening in the world and climate change, the risk is high. So Nigeria is risk prone to have floods. The issue that we can influence is in the vulnerability, right? I always put this example. It's not the same an earthquake in Japan than an earthquake in Mexico, right? Even if both of them are the same magnitude, in Japan, you are not going to see deaths. In Mexico, you're going to see a lot of them. So vulnerability can be reduced as well, and this will reduce impact. And as well, you can do preparedness. We have small examples of success with preparedness. One, for example, that we have been doing in Kaduna, and we have invited today to our specialist on that, was to do cash transfers before the floods. So basically, when the floods happen, the people already have like some cash to be prepared and to buy the food and to buy the chlorine, etc., that during the aftermath after the floods, they were ready. This was though a small scale project. So yes, floods, so the vulnerability to the floods can be decreased by doing good preparedness, having contingency plans, having safe stores for the commodities, etc. In the our long-term vision is to have a strong primary healthcare system that really can prevent, right? It's resilient and that is ready to mitigate the risks that are going to come from the floods. Having enough stocks, having good warehousing, having a strong supply chain, etc. So I would say, like summarizing in one sentence, it's like, yes, vulnerability can be reduced, but we are far away of having that in place at this moment.
Thank you very, very much. I don't know if Jumoke has any questions she wants to put forward or comments.
Thank you, Dr. Gualdo, for this presentation. I think one of the questions that I would have is, is there like a resilience plan that UNICEF can share with the Nigerian government or even the states to help prevent future occurrences like this? And also, I just want to acknowledge that Dr. Benson is online as well, so she may have additional comments. Thank you.
Dr. Benson, do you have any comments before the UNICEF team led by Dr. Blanco respond?
Yes, thank you very much to Eduardo and the team for sharing their perspectives, observations about the floods and what you have been doing in Nigeria. Really excellent. And we're excited to have you on the call today. I think a couple of things that struck me. You have talked a lot about the health and medical services intervention, and that is wonderful because it's much needed. As I was listening to you, I was thinking this is a catch-22 situation, because when people are displaced and they're looking for their daily survival, the last thing on their minds is health. But yet they need to be healthy and strong to survive. So I'm just wondering how, as UNICEF, you're able to sort of balance that need to ensure that these displaced persons actually have a safe place and that they can then focus on accessing health, the basic health services that are needed for them to actually continue to survive. And I think your point about strong, resilient health systems is really on point. It is critical. I think that's part of the bane of the Nigerian healthcare society, that our primary healthcare system is just not there, if we have to be honest with ourselves. And when you have a strong primary healthcare system, when you have crises like this, it's easier to actually mitigate the impact. So I come back to my comment and sort of also masquerading as a question in terms of how do you balance that sort of vicious cycle of getting the people situated and pursuing their medical needs.
Eduardo, I think you can respond to that or make your comments.
Okay, thank you. We have two comments. The first one, it was on the resilience plans or the preparedness plans. We do have plans. I mean, we have cholera plans. We have floods plans. I don't think the issue is about having the plans, but about making them happen. In Spanish, we said sometimes paralysis for analysis, that you spend a lot of time doing your analysis and your plans, but then you don't implement or execute them. So the problem, I think, is like we have plans, but then they are not funded, they are not costed. If they are not budgeted, if they are budgeted, the funds are not released, and if they are budgeted and the funds are released, they are not implemented. So I think a lot, and I may be linking with your initial comments about governance and leadership, is like how we can make, and I don't have the answer to that, this goes beyond my health expertise, how you can get really all these preparedness plans, resilient plans, to make them happen with a disaster occurs. And we are working very closely with the emergency units and others at the state level, but it's complicated to make that happen. Regarding the question from Dr. Joe, you're fully right. I mean, the first issue when you lose your shelter and your home is like to look for shelter, then to take care, to get food for the children, for pregnant women if they are in the family, etc. And health is often neglected and is not seen as a priority. But then you will be drinking unsafe water, you will be bitten by mosquitoes, you will not get vaccinations, and then we'll have the outbreaks. So you're fully right, and this is one of the problems that we are facing. Something that we are trying to do is to do more health promotion, what we call social behavior change, even during emergencies, to try to sensitize the communities affected on this. And as well, the other thing is like, working from both the demand and the supply side, trying to incentivize the demand, say, look, we know that now food is a priority, but as well, please vaccinate your children, get the malaria tablets, etc. And the other side is the supply side, ensuring that there is access to the health services that now they are damaged. And the typical approach is to do a mobile brigade when you send a nurse, a midwife, at least once a week with vaccinations in a call box, and as well with some tests and a small treatment. We are facing a huge challenge of human resources as well. Dr. George, you were saying, let's be honest. So let's be honest, we're changing a huge challenge of human resources. I was discussing as well that this morning with colleagues from the TB program, the malaria program. They were telling to me, we don't have medical doctors. And we know that, even senior consultants, they're going to the UK and to other places. So imagine at primary healthcare level, so we have a huge shortage of human resources, and until we don't sort this out, we're not going to solve all the public health issues that we were mentioning at the beginning. So I don't have the answer for you. Maybe I would like to have it, but it's tricky. And I think we need to have that vision of having the long-term vision of how a robust, sound, strong primary healthcare level system in the country should be.
Wonderful. I see two hands up, Tayo and Joe. Can you please take your questions, 1 minute or 30 seconds each, or if you have comments, so that Eduardo can respond to that.
Okay. Can I go on?
Yeah, Tayo, please go on.
All right. Thank you so much. Thank you, Dr. Eduardo. My challenge is this. I know UNICEF is a leading development partner. Why don't we have a universal, cohesive plan between development partners looking at the flood situation in Nigeria? I've been following some funding. The World Bank has funded in about 5-6 states flood risk management in the past, or your state and some parts. And we still have these problems of shortage of resources to respond to recovery and resilience. The complementary comment or question is also, why don't we have a national vulnerability assessment plan and also a national flood risk plan? I mean, this flood is not the first. Almost annually, we experience floods in different parts of the country. So why are development partners still not addressing it from a universal, cohesive front, whereby more resources, a basket of funds is available, and each one has execution plans that can really respond to recovery, resilience, rebuilding, and resilience? Thank you.
Thank you very much. Can we then get the other question before we respond to that? Joe? Joe, unmute yourself. Backhand is unmuting. Unmute yourself. J-O-E. Backhand.
Can you hear me?
Yeah, we can hear you.
Okay, great. So Eduardo, you had mentioned, several things that you felt, we could do. So my question to you is, could you just drill down a little bit, further into that first one, either supporting UNICEF or other, local NGOs, but just specifically, we've got top 3 things in that support. What does that look like? What are the top 3 things that you would say that support should look like, that you feel will make some impact to complement the work that you're doing. Thank you.
Good. Yeah. Can I take another question from NDP staff? I don't know who that is. Can you introduce yourself and go straight to your question?
Okay, this is Mr. Dada from Chicago. My question is, I'd like to thank UNICEF, sincerely for what you are doing. But in Nigeria, as big as it is, I know we are very bad in management. We house so many international oil companies and others that are taking our resources. Have you approached them? Have you asked them? And what can they do? And what's their response? Before other international organizations, US gave 10 million to Pakistan for the same problem. And we have as much problem more than Pakistan, and they gave us 1 million. What's responsible for that? You see, why do they consider us not, or this particular flooding not to be serious? What's your experience with the international organization and international agency, particularly towards Nigeria?
Thank you very much. And then we'll take one last question from Zion, the Mandate Health Empowerment. Please introduce yourself, unmute, and go straight to your question or comment.
Thank you very much, Pastor, for the opportunity. My name is Zion from Mandate Health Empowerment Initiative, Nigeria. Thanks a lot, Eduardo, and your colleagues for the amazing presentations. I want to ask, aside all the amazing works and interventions you're doing, particularly to the WASH and the other nutritional programs you're doing, is there a chance of mainstreaming mental health services, seeing that psychologically these displaced persons or this population of people who have been impacted by this flood might be coming down with some form of mental illnesses, maybe like anxiety disorder or depression or the likes. Is there a chance, or is there an opportunity that you're considering mainstreaming mental health services for this particular population of persons? Thank you very much.
Right. Eduardo, maybe we should give you a time to respond to all these comments and questions before we go to the next round of questions.
Right. I have here 4 questions listed, and some of them are quite complicated. So I will do as much as I can. Regarding the first one, on alignment of the partners and harmonization of investments, I do agree that we are far from ideal. We as partners, we work together. We have coordination groups at the UN, humanitarian working groups, as well with the government, of course, at both national and subnational level. However, more can be done. I fully agree with you. We have an incomplete picture. The UN has been very active in these floods. The resident coordinator, that is the humanitarian coordinator, has been personally visiting 2 states in the south, and we are working together. But of course, I would say it's not enough. I agree with you. There are still overlaps, there are gaps, etc. Maybe I will link this with the third question that was about the support that Nigeria is receiving. For example, for the floods, OCHA, this is the humanitarian agency of the UN, has given $2.5 million. I think it was $5 million in total for the floods. It's less than the Pakistan example, maybe, but there has been $5 million to respond in the floods. It's true that was not in October. It was the funds only arrived to the country this week, so 5 weeks after the floods, and so some improvements are needed regarding the timing of the response, right? I think that's important, not only on the amount. But overall, I think Nigeria, it's becoming a complicated sale for donors and international partners. Nigeria is a middle-income country, but in practice, there are a lot of inequalities. So some of the states, for example, in the north, like Sokoto, Zamfara, the states where they have really poor indicators, for example, in health. In Sokoto, only 1 out of 10 children is vaccinated, for example. This is similar or even worse that you can find in South Sudan. In the southern states, in Akwa Ibom, maybe you have 90%. So there is a lot of inequalities. This is a huge issue. But from the headquarters of the big donors, it is difficult to see. Big investments like the Global Fund, for example, is investing $1 billion every 3 years in Nigeria. Or Gavi is another $1 billion in vaccination. But this is going to end as a deadline. In 2028, all this support will end because the government is supposed to take it forward. How is this going to happen? I don't know. But just to say that what we think is going to happen is like we're going to see a reduction of international aid to Nigeria over the coming years, especially as well because there are many competing priorities like the Ukraine, the hunger crisis that we are seeing, climate change in other places. So we are expecting that. So I think the long-term solution is more internal investments, right? And taxation and others. Regarding the top 3 priorities, I would say only 2 priorities, I would say. One is cholera kits, to be ready for the cholera outbreak. It's very easy, a cholera kit. I don't have the amount in the mind, but it's not too expensive. So the drugs that are needed to treat and prevent cholera need to be there. Cholera is a big killer of under 5. We know it's going to happen. So being able to support with medicines and drugs through the cholera kit or other mechanisms will be priority number 1. Priority number 2 is more complex. Needs to be done through an NGO, a federation, or UNICEF or WHO. Is to support mobile brigades, like in Bajelsa or in other places, just to be able to send teams of medical doctors and nurses to the IDP camps. So I would say that that's our 2 main priorities. Actually, is what we are doing at this moment because it's what we know that is going to save lives. And finally, the last question on mental health. I cannot agree more. And for us, from our side, at this moment in UNICEF, we don't have the capacity to do that. We fully acknowledge that it's critical to address mental health in Nigeria as a whole, not only for IDPs, but as well, we are seeing like we want to work with adolescents in mental health in urban areas, and as well, of course, with all the IDPs, both in the north, northeast, northwest, but as well as the floods. We don't have the expertise at this moment. There are others that they do have it, MSF, Médecins Sans Frontières, Doctors Without Borders. And for the next 5 years, we're going to start to do that. Actually, again, I was discussing it just before coming to this meeting on the needs of mental health. But at this moment, unfortunately, we don't have the staff, the resources to do it. But we are thinking on doing it to try to hire someone or to look for partners to do that. So it's a priority. Thank you.
Thank you very much, Eduardo. We're going to be taking a couple more questions. I don't know how much time you have with us on the platform, but if you need to go, let us know so that we don't keep you here. But we still have a couple of questions. But I wanted to ask you some questions from my side. I know that you are UNICEF, you're an international agency, you work all over the world, and so on and so forth. I don't know if you have a rating for nations as to how prepared they are for health issues, disaster management, and things like that. And where in that spectrum do you think Nigeria fits? And what do you think the steps that a serious government should take to respond to this and take us a little bit higher on the scale? And maybe you can share experiences with other nations with us. That's the first part. The second part is, if you are able, and if you are not, that's okay, to help us review the state of our health system in Nigeria, especially primary health care, and what, in your opinion, a responsible government or a responsive government can do as a matter of plan and roadmap to improve this thing, if it needs to be improved, and the effects that it could have on the economy. Those are my two inquiries at this point in time. And then I'm going to ask Afolabi Ajidao to ask his question or make his comments, Mr. Okulaja Taiwo, and then Femi Olowe. And then we will ask you to please respond to those questions. Afolabi, please.
Good evening, everybody. Thank you for joining for this seminar and this education. You're indicating that Europe is going to be funding or donating less and less to Nigeria in the next few years. By any chance, what are your projections, if you have any, of the floodings for the next 3 years or 5 years in Nigeria? If you have any, if you have done any studies, or can give us any indications. And finally, my final question is, we're talking about climate change basically here. Climate change was caused mostly by European and the Industrial Revolution and the Industrial Age. Don't you feel it is upon the Europeans, upon the industrialized countries to be more responsible in helping African and developing nations? Thanks. Those are my questions. Thank you.
Thank you very much, Afolabi. I dare say those are very excellent questions, and I'm sure that Eduardo would respond appropriately to them. Mr. Okulaja Taiwo.
Hello?
Yeah, go ahead, please. We can hear you.
My own is question and suggestion. Now, most of these disaster issues are not prepared for by our government. And in a lot of ways, even the community themselves don't have technical know-how to sense that this thing will happen, this will happen. I'm asking if there's any plan with UNICEF for training, more especially community that CDAs, community development associations, to see signs they will see. Like the type of cholera you are talking now, because of the increase in rainfall around Lagos, in my neighborhood, we have seen some signs of cholera. We have sending signal to people. For those that are drinking their borehole direct to that treatment, they should stop it for now, because for those of them that are going to public school, they have been sensing some vomiting, continual vomiting. So what am I saying is, the UNICEF, what is their plan for training community to be able to handle everything on their own, so that at least they will reduce the effect of this, all this, both flood, all this disaster, any disaster of any kind. This community should be sensitized so that they can know what to do or escalate it to the government in good time. That's my question.
Thank you very much. We'll take the last one from Femi Olowe, please.
Good afternoon once again. My question goes thus. Over the years, you find out that from UNICEF, from World Aid organizations like World Bank, you always find out that when monetary aid come into the country, when material aids come into the country or any country, not only in Nigeria, but especially in Nigeria, you see that about 80 to 85% of these aids go to certain parts of the north. And that's also reflected in your analysis of saying that cholera outbreak, the equipment, the vaccination, and that 92% of people around the southern part are well vaccinated, while in the north, it is not like so. So my question is, so given the fact that when aids come, you also see a large percentage of it going to the northern part of Nigeria, of the country. Now I want to ask, what determines the distribution of these aids? One. Number two, how does UNICEF, as a body which you represent today, how do you disburse aids, whether in terms of material or in terms of cash? How do you disburse it, and what is the pro rata arrangement that you have? What decides the distribution of these kids? That is what I want to know. Thank you.
Right. Eduardo, over to you.
Thank you very much. And I am really enjoying being here and as well being challenged, right? Here we are, Nigeria is our constituency as any UN agency. And I am really enjoying this conversation. Just starting on the ranking, I don't think we have a formal ranking in terms of preparedness from health for natural disasters. We have several rankings on vulnerability. Many countries that they are in, for example, in the east coast of Africa, as well as small islands, are more vulnerable than Nigeria. That's the reality. My personal feeling is like more can be done in terms of preparedness, right? I was mentioning before the pilot that we had with cash transfers before the floods. But in general, the main challenge that we have is the systems are weak. Education, health, the social services are weak. And this, the best preparedness is strong investments in your systems, in education, in health, in preparedness, etc. And this is difficult for decision makers, right? Because yes, we know that $1 today saves $100 later, but it's difficult to put that dollar in front only for preparedness. So we are seeing that. We are looking as well in other different ways of working. For example, with the Nigerian CDC, we are exploring how we can front load some resources so they can use it as soon as something happens without more approvals needed. So we're trying to think in a different way and learning from other countries. We brought specialists from other countries, from Mozambique, from Switzerland, so to try to think how they are doing it, from Holland. So we're trying to look at that, but I don't have a ranking, so sorry for that. Regarding primary health care and what I think it's much more needed, I will summarize in one need: human resources. Human resources for health. We have the number of nurses and doctors that we have is extremely low. We are talking about 3 doctors every 10,000 people. We have a massive problem of brain drain, right? Instead of brain gain. And I am very honest when these discussions happen. I was discussing with the deputy high commissioner of the UK like 1 month ago in Lagos. And I told him, it's like you're doing aid with one hand and getting doctors with the other hand, right? And of course, I understand the doctors that they are looking for a much better life. I mean, in a Jigawa, a doctor can earn 150,000 nairas, right? And so how we can expect that we have doctors in LGAs and remote LGAs in places that on top of that are insecure? So we really need to have a clear package to attract and to retain human resources for health. I think to me that's priority number 1. Regarding the projections of the floods, I don't have projections as such, but what we do know is that climate change events are more frequent, it happens more often, and they are more severe. So I would say I will not expect the situation to improve, and I will expect that next year we'll be facing similar challenges. What is the role of aid, as you were asking? Like some rich countries are the ones that they are behind all of this. You're right. I mean, we appeal to the international community to really internalize the cost of the actions that they are doing, right? I think I am not optimistic, I have to say, especially for Nigeria. Nigeria now, it's considered by the World Bank rankings that as a middle-income country. This automatically disqualifies you for many aid projects and funds. So as soon as you get that status, you are out of accessing many funds, and then exceptions need to be approved, and it's complicated. Still, the UN, for example, has $1 billion operation in the Northeast because of the insecurity situation there, but this is quite unique. in terms of the country is seen as a middle income country. So this is a challenge that is not going to disappear. If you ask me, my personal opinion, this needs to come from improved taxation and allocation of resources for social services. That needs to be the way forward. Regarding the question on training at community level, fully agree, 100%. We are investing a lot on that. We have here, we have this figure called CHIPS, Community Health Influencers and Promoters. The big problem to me is that they need to be sustained by the government, by the state governments. And this is happening in a very slow pace. I would like, our objective, very ambitious, is to have 50,000 more CHIPS in the country over the next 5 years. But the states, they need to make fiscal space to hire them. We can train them as UNICEF, and we're doing it. But then who's going to pay them the allowance in monthly basis? And it's nothing, it's 5,000 nairas per month, so it's $10, right? So, but states need to step up to do that. And we're helping from loading resources, but in the long term, in 2-3 years, what's going to happen? So, but yes, in terms of training, that's a clear priority. And finally, the question on how the aid is allocated. I mean, we as UNICEF, we look to data, right, and to the needs. So we need to respond based on evidence. So most of our investments are going to the northwest and to the northeast, and this is purely based on data. I have to be very honest. You know, as I was saying, in Sokoto, 1 out of 10 children are vaccinated. In Bauchi, 1 out of 2 teenagers, less than 18 years old, have had already a baby. Well, 1 out of 2. So this is massive numbers, right? And this is in Bauchi. So we are putting most of our investments based on that. Still, as the UN, we are not a northern organization, so we work for the whole country. So we have offices as UNICEF in Lagos, in Akure, in Port Harcourt, in Enugu. We are now supporting the IDPs in Benue. We are starting to work. We are working with the Lagos health insurance system. We are responding in Bayelsa. We have big investments as well in Cross Rivers, in Ogun, in Ojo. So we believe that investments need to happen, but they are in different ones. Maybe in Ojo, in Ogun, we are working more targeted investments. We're working more in the health insurance, in policy changes. In the north, we are working more in service delivery. So it's different approaches of doing it. We as UNICEF, most of our investments go through the state governments, as well as central level, but as well we work with NGO and local partners as well, and as well we implement that. I will stop here. So over back to the moderator. I hope I responded some of the questions and that clarify a little bit how we work.
Thank you very, very much. We'll just take another round of questions and then we'll bring this meeting to a close so that we can't over-exhaust everything in one session. And I'm sure that Dr. Blanco and his team will be back at some stage to give us other perspectives to health in Nigeria. I'm sure that the flood and the health results of the flood is just one of the things that they do. And maybe one of the things that he might speak to this time around is what are the other things that UNICEF does in Nigeria, possibly in Africa. Do they accept partners, and how can we on ALG partner with them and work alongside them to support whatever they're doing, or to add value to it, or to even support the health system in Nigeria, because that's part of what we want to do, to support government, to support health, support governance in education, health, and whatever it is that we can within the limits of our resources. I think it would be nice if you would speak to these two things, what else UNICEF does in Nigeria, what they are willing to do, and if they're open to partnerships and support, or what do they think organizations can do to help deepen the health situation in Nigeria, and also the institutions and the policies and progresses of health in Nigeria. Thereafter, we'll take a question from Rosemary, and somebody else had lifted up their hands, but I can't see it right now. And then we begin to close. Idris Baba.
It was Idris.
Idris Baba. Okay, so do you want the other two questions to come, or do you want to respond to what I've said first?
Yeah, maybe again we can get the two questions and then I will respond.
Okay, Rosemary.
Good afternoon, everyone. My name is Rosemary Wellington, and I worked in UNICEF Nigeria for nearly 15 years, several years ago, and then I went international. Now, I hear some of the same issues that we had addressed way back, years back, coming to the fore. Primary healthcare, immunization, cholera prevention, and so on and so forth. It just goes to show that the cycle of life continues. Now, having said that, is there a communication for development section? I'm not talking of advocacy with government. I'm talking of community level services where your community leaders, your churches, community-based organizations join hands with UNICEF to mobilize the population. If you are trying to prevent cholera, how much of their engagement comes in to teach them how to mix that salt and sugar or use the cholera kit? How much belief will they have in a system where they are just devastated with the flood that is on the ground? What are the community level organizations and the traditional leaders? Have you gotten empirical evidence from those organizations to say, in the order of priority, please start with step 1, 2, 3, while the health interventions are going on? And I recall very well that through the years, it is the communication for development section that does the foot soldiering, that does the community mobilization, that does the social mobilization, that does the social advocacy, that gets their partnership and their agreement to do what you, the health section and the nutrition section and the water and sanitation section would like to achieve. Does that still exist in UNICEF Nigeria? And how much of that has come into play in this flood situation? Thank you.
Thank you very much, Rosemary. I was glad to see UNICEF Nigeria alumni on the platform. Femi Olowe, please, and then Baba. I can't find Baba. Baba keeps hiding.
Okay, so I will not take time. This is my second question. Yeah, so I'm drawing it from the answer that the UNICEF representative gave. Now that we know how the funds are being distributed, and we know the data that are being used for the disbursement and the distribution. Now, in management, we have PDCA cycle. That's the plan, the do, the act, and the check. So which is a cycle, which is a manager's thought process, meaning that when you put up a plan concerning how to stem a particular problem, you go and execute all the actions. And there are also the checks that you do, the check measures or parameters to know that, yes, we are not just going through a vicious cycle. I would want to say that over the years, and just as the UNICEF alumni, the woman that spoke just now, just as she put it, that there were some of the issues that have occurred before, and we are mentioning them now. And when you look at Millennium Development Goals, every year, almost all the governors in Nigeria, they signed a pact, and they made us believe that they are doing it. And even up to NYSC level, that's National Youth Corps, NYSC level, National Youth Corps Commission, you find the youth graduates serving for 1 year being the framework to implement MDGs. And you find out that, okay, at the end of the day, is there a way we are checking that these things are working or not? Please, I want to say that, or I want to ask, is there any step that UNICEF and any other agencies, international agencies, are using to check the implementation, the successful implementation of all their programs? Are their targets, are there sustainable targets, not just we want to reduce polio from 10%, from 80% to 10%. We need what is sustainable. We need what is sustainable. We need people to be held accountable. We need some people to be responsible so that every year you don't come and be spending, huge amounts, huge millions of dollars addressing the same issue over year upon year. Is there any route that the UNICEF is taking to ensure that we don't go through a vicious cycle all the time, keep spending the same amount, and then we'll come in the next 2 years and find out that in Sokoto, 1 out of 10 children is not vaccinated? Thank you.
Thank you very much. We'll then take Baba. There's some Baba. Are you still asking your question, Idris?
Yes.
Baba?
Yes, I'm sorry. I think I will allow the questions to go. I'll make some comment maybe on the preparedness response from the UNICEF perspective.
Okay, all right.
Thank you.
Thank you, Idris. Eduardo?
Thank you, Idris. Thank you very much. I will try to be brief, but just starting what UNICEF does. From the health perspective, I'm going to talk. No, I'm going to talk to other sectors that we are working, like nutrition, wash, and education. So our main objective is to reduce women and children's mortality, right, and improve their health. And we do it through three main objectives, three main outcomes. The first one is to improve the primary healthcare system, and we have talked a lot about that today. We have focused on human resources and health financing. The second priority that we have is to improve maternal, child, and neonatal health outcomes. So basically, we're working out at community level to try to reduce, to try to increase that the women go to the health facilities to have deliveries, to have neonatal corners, and even to have oxygen in hospitals. So this is our second priority. And our third priority is to get children vaccinated, to increase the coverage, so more children vaccinated, and to reduce the number of zero-dose children. We call zero-dose children is the children that they were never vaccinated against anything. And Nigeria is the second country in the world with more zero-dose children, like 2.2 million children that they didn't receive any vaccine. So this is our three priorities. And then we have a cross-cutting priority that is the public health emergencies response, like the floods, the cholera, the measles, Lassa fever, monkeypox. I mean, we have all the ones that they affect women and children, so we have them here and we are responding to them. Not to monkeypox, though, but to the rest of us. So this is our main priorities. We will be happy to partner. I am really impressed by this group, really of the African Leaders Group. We work mostly with and through government, but we are expanding our network of partners. Like this year, we started to work with the Nigerian Governor Forum, with the Red Cross, we're looking for other CSOs and NGOs, and Nigeria Health Watch, and others. So there are different ways of partnering with us. We'll be more than happy to explore that, right? It's like look into what you guys are doing, what we are doing, and we'll be happy to have a discussion on that. Rosemary, regarding the C4D and section, is still there, and I'm sure that you still have colleagues there and former colleagues. We have people that have been working here for 20 years. I am sure that Margaret and others, if you remember them, they're still around. Now we changed the name to SBC. So the section is not called C4D, Communication for Development, anymore. Now it's called Social Behavior Change, but they are still there. They are working very well and with presence in all our field offices, working out in polio, but a lot in many issues. So you will be happy to see that they are still there. Rosemary, you're welcome anytime that you come to Abuja to pop in our offices, and I'm sure that you will find all friends and colleagues around. Regarding how we are assessing and evaluating our projects, we do, of course we do. I mean, and of course we understand that sometimes we don't achieve our targets and our outputs. We are seeing progress. That's the reality. We just got a national survey results out, the MIX. It's called MIX, and it was done in December, January. So we got all the information on how the health situation has been evolving. And the country, we need to be honest, has made progress. Vaccination, coverage of Penta 3 is our coverage of vaccination, moved from 50% to 57%. Zero-dose children has been reduced, right, to 30%. Skilled birth attendance has been increased to 50%. Now, 1 out of 2 women in Nigeria, they have birth at health facility level. So the indicators have improved. However, we have 2 main challenges. First challenge, that this is not enough to achieve the SDG 3 targets. So the Sustainable Development Goals, we're not going to achieve them at the current pace. That's a fact if we don't accelerate. And the second challenge is the massive inequalities. So to respond to the question, yes, we are assessing our results. Yes, we understand that the pace is not the one that we would like to see. We are trying to get more political commitment and to have mutual accountability frameworks. So we agree in some deliverables and all of us with accountability. So we're moving in that direction. I don't think UNICEF can solve all the problems. We can contribute to them, and we do. And I think this should be a joint effort of the government, civil society, diaspora, UN agencies, other partners. So I am, in general, I am optimistic. A lot of things need to be done. It's unlikely we'll get our results, our targets by 2030, but we are in the right pace. Sorry, we're in the right direction. What needs to happen is like more speed, accelerate, and to get more results and more ownership and sustainability. And I will stop here. That will you allow me.
Thank you so much. Thank you. I don't know if Idris wanted to make some comments before we round up. Idris, can you unmute yourself? You wanted to say a few things.
Okay, thank you very much. I'm not allowed to unmute. Thank you very much. I just want to add to what Eduardo said, maybe the Kaduna perspective in terms of the preparedness. One colleague asked very specifically in terms of what Kaduna does, what UNICEF does. For example, we are actually very mindful of this preparedness issue that our colleague spoke about. UNICEF fund is not very big that will say we can change the nation from one perspective with one big basket of money. We don't have that kind of money. I'm sure Eduardo will agree with that. So we try to be a bit catalytic and learn from what we do. In Kaduna, for example, in trying to ensure that we show government that things are happening. We have supported the government of Kaduna State to develop the state multi-hazard contingency plan, which provides for coordination of the humanitarian response in the event of catastrophic and major disaster in the state. And actually, the objective is mainly to guide in ensuring that the state multi-hazard contingency plan for emergency response. We also should have a sectoral response plan based on what each sector should do, and trying to advocate with government to budget and preposition for some supplies, which has always been an issue, which Eduardo spoke about. How do we get government to actually do its own bit of the whole thing? After doing that in Kaduna, for example, we are also able to go down to the local government level to ensure that in all the 20 local government levels, they have the same emergency response committees in the local government level, working with the community structure that our colleague from UNICEF spoke about, the VCMs, we call them voluntary community mobilizers. We have about 1,578 of them working in Kaduna in all the local governments. And what they usually do is to ensure that people are sensitized on what comes their way in terms of both disease outcome and preventions, trying to ensure that people are well sensitized. So we have the structure, and we've been working in that direction. to ensure that government also take over this kind of things, and then we now go to scale in other states. But I'm sure maybe Eduardo will take this forward in terms of how do we get your own buy-in, working just like you said through the Nigerian Governance Forum, to show these catalytic moves and how these things can actually change the narrative across different states based on contextual situations. The colleague from who was asking in terms of how we prorate funds, the contexts are different. So maybe the needs might be different, the funding stream might be different. Not just a one size fit all kind of disbursement, but based on issues and evidence. If we can get this kind of support from you to use evidence to show catalytic moves and catalytic models that work for the country and get government to actually move in that direction, I think it will go a long way in ensuring that we make a lot of difference. But with over 20,000 community mobilizers being funded by UNICEF at the moment on the ground in Nigeria, I think we have a lot of communication structure that is going on across the country, which is what our colleagues was asking. Yes, they are there, about 20,000 of them working from door to door, ensuring that we communicate messages. But we still have another gap in terms of human resources and what we can do with funds. But we are still open to more suggestions and more collaboration. Thank you.
Thank you very, very much. Good. I think we're bringing the session to an end, and I just want Eduardo to give us any closing remarks that he has.
Thank you. Thank you very much, first of all, for inviting us. It's I really have enjoyed the conversation. Really, it's great to get your questions, but as well your inputs. So just to pass my appreciation, as I said, I think Nigeria faced many challenges, but as well has shown again and again that can get results. And I remember that polio, for example, the country got the polio-free certification 2 years ago, for example. So everything that everybody says that everything is impossible until it's done, and I see that in Nigeria, things are possible. So I'm really happy to be here, to be contributing to the response, and you have our commitment as UNICEF that we will continue here as much as it's needed. So thank you very much for inviting us. It was really, really great.
Thank you very much for coming. God bless you. We wish you a very wonderful tenure in Nigeria. How long are you going to be in Nigeria for?
3 years.
3 years. We wish you a very wonderful tenure in Nigeria. I look forward to meeting you personally and physically. Maybe when next you're in Lagos, you let me know. When next I come to Abuja, I would get your contacts, and then we can have a meeting and discuss a few other things. Thank you very much to your team. Also, Egu, I think, Dr. Ifeanyiwa and Idris Baba, thank you very much for all you are doing to help us in Nigeria and support health in Nigeria. God bless you all, and have a wonderful rest of the evening and a great weekend ahead. Thank you very much. God bless you.
Thank you.
Thank you. Thank you for such a great presentation.